Yeah, hello, lovely people. We welcome you once again to our timely and then educative lessons. And then we are continuing with what we started previously in our first episode. We started talking about a condition termed as shock. And then the first episode, we gave a brief introduction about the condition. In our second episode, we would want to talk about the classifications of shock. And then we can classify shock mainly under two main categories. According to the onset, as in the time within which the shock occurred, or according to the cause, what is actually contributing to the occurrence of the shock. So when we take the time, or as to the time of occurrence, it is either the shock is occurring immediately or concurrently with the incident, whether an accident or whatever issue or injury or even medical disease or illness. So the shock would occur immediately within some few hours within the occurrence of the unforeseen situation. And that can be termed as the primary. So the primary means that it is sudden. The onset is sudden, and then it occurs within some few period after either the accident or the disease condition or unforeseen situation. And because it is immediately, mostly it is associated with pain. So that is with the primary. And if it is occurring some hours after the assault or trauma or injury, then it becomes secondary. So with the time, and it is either it is primary shock or secondary shock. And according to the cause, we can also classify shock under four main categories. So whether it is a hypovolemic shock, also termed as the Neurogenic shock, or whether it is a cardiogenic shock, an obstructive shock, or a distributive shock. So shock according to cause can be classified under four main categories, whether it is hypovolemic, whether it is cardiogenic, whether it is a distributive or obstructive shock. So let's quickly go through each of them. So when we take hypovolemic shock, it is from two words, hypo and then volemia. So hypo means a reduction, and then volemia. Emia is talking about the blood, and then the vol is talking about the volume. So in conjunction, we can say hypovolemia is just a reduction in the amount of blood. So under the hypovolemic shock, any shock that results when there is a reduction in the volume of the blood circulated becomes a hypovolemic shock. And then these can result from conditions in which we would lose blood from circulation. So we can talk of fractures when there is a break in bone, and then the break in bone is contributing to a rupture of a vessel, whether it is a compound fracture or it is an open fracture, or whether it is hemorrhage, bleeding. And we know in hemorrhage, basically, there would be a trauma to any of the blood vessels, whether an artery, a vein, or a capillary. And it can either be internal bleeding or external bleeding. We can also talk of burns and scalds. And we know that in burns, there is the high incidence of dehydration. Because of the heat or whatever cause, there is rapid loss of blood from circulation. We can also talk about severe vomiting and diarrhea. So someone might have a gastrointestinal problem, and as a matter of that, the person is vomiting excessively, or the person is having a severe diarrhea. we know that the vomitous or the diarrhea stool, they are liquid in nature, so the individual would lose high amounts of blood. Then we can also talk of the fact that when there is any condition, and then this condition is sudden and it is associated with pain, which we can talk about the perforated gastritis. So we know that we have some conditions in which, for example, someone having a peptic ulcer disease, and this condition is not well managed, the condition can cause perforation in the mucosal lining. And within these lining, we have blood vessels within. So the individual tends to bleed internally. So some of these, and among others, are causes under the hypovolemic shock. So hypovolemic shock, any shock that would result when there is a reduction in the flow of blood through circulation. Then we can also talk about the distributive shock. So under the distributive, it is a collection. So we can talk of either it is a neurogenic, or whether it is a septic shock or an anaphylactic shock. So under distributive, we can talk of three main types of shock. Is it neurogenic? Is it a septic shock? Or is it an anaphylactic shock? So let's go through them in simple terms. So neurogenic has to deal with the nervous system or the brain. So when there is any problem affecting the nervous system or the brain, this would contribute to a neurogenic shock. And then the pathophysiology of neurogenic shock, or all types of shock in relation to the brain, is that we've already established the fact that the brain is an organ that requires oxygen and nutrients within every single minute or second. So when there is a deprivation to the brain, as in a condition of the brain or the nervous system, as in a spinal cord injury, or even when the individual faces any fearful object. So sometimes there is an accident scene. The individual sees the casualty lying in a pool of blood, and based on anxiety, the person goes into a neurogenic shock. This is because in that condition, the brain, in attempt of seeing those fearful situations, there is something we call lean stress, the fight or flee response. There is the release of what we call catecholamines, or the adrenaline or the noradrenaline, or epinephrine or norepinephrine. And when these hormones are released, they act on the sympathetic nervous system. So the sympathetic nervous system would be stimulated to release these neurotransmitters or hormones. And when these hormones are released, they cause vasodilations of vessels. So they cause internal vessels to dilate. And when they dilate, just imagine how the circulatory system works. It works in a sense that the vessels are within an estimated diameter. So let's say you have two barrels, or you have two vessels. One is medium size, and then we have 100 mils of blood flowing through it. And then the same 100 mils of blood is being made to flow through it a diameter at, let's say, 20 inches or 30 inches. You would see that now, because there has been an increment and there is the same amount of blood flowing through, the blood would flow at a steady rate, contributing to what we call the low blood pressure. So the low blood pressure in shock is as a result of the vasodilation, the vessels enlarging, and then the same amount of blood flowing through them. It means that the blood would have to flow at a steady rate. That is with that. So with the neurogenic shock, that is the physiology. So anything causing fear or panic, or anything affecting the nervous system would contribute to a neurogenic shock. So the neurogenic shock can also be termed as the psychogenic shock. Psyche deals with the mind. So whether you see neurogenic or the psychogenic, it deals with the brain or the mind. And that is what mainly we term as fainting. So sometimes somebody would see a fearful object or image and then the person would faint. It is because it is a neurogenic or a psychogenic shock. So that is with that. We move on to what we term as the septic shock. So the septic shock is also just a shock that results as a result of infection. So the septic shock results from infection. And we know that infections are mainly caused by bacterial organisms. So when these bacterial organisms invade into the blood system, as in septicemia or toxemia, they produce what we call toxins. As a result of their function or activity, the byproduct these bacteria produces are toxins. And these toxins are poisonous to the body. So when these toxins are being released into the circulating blood, as part of the homeostatic mechanism, blood vessels would have to dilate in order for immune response to take place. So blood would want to flow to the site, and then platelet or white blood cells work on them. So the blood vessels would dilate, and as they dilate, it will contribute to the reduction in how the blood is flowing through the vessels. So that is with what? The septic shock. So any bacterial infection contributing to the production of toxins. Then we can also talk about the anaphylactic shock. So with the anaphylactic shock, this is a type of shock that results from allergic reactions. And this type of shock is really life-threatening because it usually occurs immediately or within a shortest possible time when the individual has been introduced to whatever allergic substance, whether it is a pollen grain, it can be a venom from a bee sting, it can be as a result of a medication, or even food and food additives. So these substances, when the individual's body becomes allergic or react to these things, it contributes to what we call the anaphylactic shock. So in allergic reactions, what really happens is that as part of the inflammatory response to the allergy, there is also the vasodilations. And then the vasodilations would in turn contribute to the individual getting the shock. So we've talked under the distributive, we talked of the neurogenic, the septic, and then the anaphylactic shock. So we now move on to the obstructive shock. So with the obstructive shock, we would want to say that when we say obstructive, meaning that something is blocking the passage. So in obstructive shock, this is just the type of shock in which there is an obstruction in the flow of blood through the vessels. So ideally, the blood vessels should be patent so that blood can freely flow through them to the body tissues and then internal organs. So if, let's say, there is an obstruction, whether it is a thrombus or whether it is a tamponade that is preventing blood from what? Flowing, then basically blood would be accumulated in the heart but cannot flow to the internal organs and then the other body tissues, contributing to shock. Then lastly, we talk about the cardiogenic shock. So the cardio deals with the heart. So any condition, any ailment affecting how the heart pumps would contribute to what? A cardiogenic shock. So for the cardiogenic shock, we can talk about an occlusion in the coronary artery, because we said earlier on that the heart itself has vessels that supplies it with oxygenated blood. So we have the coronary artery that supplies the heart with oxygenated blood. So if there is an occlusion, whether the vessel is narrowing or whether there is a thrombus closing the vessel, it means that blood supply to the heart itself would be impeded and the heart cannot contract. And then again, we can talk of some medications. We have some medications that affect the activities of the heart. So some medications contribute to smooth muscles relaxations. And these medications, if not taken in its right dose and at the right time, would cause the blood to lose its ability to contract. And when it loses its ability to contract, blood cannot pump through the heart to vital body parts. So these are just the types of shock we had wanted to take you through. So shock, according to the classification, is either with the timing or the cause. With the timing, we said we have whether it is primary or secondary. And with the cause, whether it is a hypovolemic, whether it is a distributive, whether it is obstructive or cardiogenic. And under distributive, we said whether it is a neurogenic shock, whether it is a septic shock, or whether it is an anaphylactic shock. Thank you very much for watching. We would meet some other time on the stages of shock. Bye-bye.